Let's talk a little bit about what happened to you, like a step by step, because we haven't said for viewers of this what really happened to you next. And you mentioned about surgery, which probably was at Queen's Medical Centre.
It was.
But what were the stages in getting back to the where you are now? What were the steps you had to go through?
First off, surgery was actually cancelled because I couldn't match blood. That was actually a very good thing at the time. It was very, 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 very upsetting to find you're on a ward and you're prepared and everything, and then it doesn't go ahead. But it was a great benefit because I can actually see other patients who had surgery come out of theatre and be talking and reacting. It takes away all the fear that somebody giving you brain surgery, you might not come back, and that had all gone. So that was the good side of it. After the surgery itself, it knocks you for six. It took me several months before I could get up and move around, before I could do things. Going from A to B was difficult. Swelling, knowing that your sight that you were so used to was so totally different, that you can't see things, that there's a patch missing, that you can't judge distances. Walking through a door, well, if you open a door but you can't see it on one side of your head, it's a good job I'm the size I am because I'm bouncy material and bump into it and bounce off. But you end up with lots of bruises and bits and pieces because you can't see what you're doing. People around you assume that you can and can't accept that there is differences in you and that what you do and what you see is different. And that's sometimes a constant battle with your own family, is to know they know you but they don't know the new you.
In a way, they've got to learn that new you as well as
Yes.
you learning it. And that's difficult for them, isn't it?
That's very, very difficult for them, and I also found that diplomacy goes out the window, and there is this change in you as a person, that diplomacy's gone and you tend to speak the truth. At point blank range can be quite cutting. Actually learning to adjust that back is extremely difficult as well, and that's shock to the family.
Was that an effect of the tumour or something else?
Don't know. Nobody can put a finger on it. There are effects to the tumour which, again, nobody knew and nobody has told you. And removing it, there are some good effects, there are some weird ones. Good effects were my hands and feet were numb and nobody could explain why. The position of the tumour had said, but it has nothing to do with that, but within 4 days my feelings are back. Temperatures, everything wonderful. Downside was things like going to sleep. Since the tumour, it's not a slow go to sleep. And it isn't a slow come round awake, it's instant. It's like you're awake 1 minute and then you're gone. It's like somebody switched the lights off. And waking up is one breath, you're awake, you're asking questions, you're talking, there's nothing else. It's weird. And it's affected the hearing in such that, whether it's to do with a sight loss or difficult to put into it. Somebody in another room eating a packet of crisps, it's like somebody scratching the crisps beside your ear. The sound can be so intense.
What type of tumour was it that was diagnosed?
It's a meningioma. Now, the type I got apparently is slightly different to what is normal. Normally it will affect the meninges, which is the lining around the brain. Mine was not. It was within the bone, and the bone had thickened. So it actually didn't affect the meninges at all, but it's the bone around the socket. roof of the socket, the wing of the socket. There is still some there.
On the left-hand side?
On the left-hand side, yes.
And
the palsy's on the right side. Not connected.
what residual amount of tumour has been left there after the treatment?
2 or 3 centimetres, a couple of centimetre or so, so that it's affecting the optic nerve. The good side is it's extremely slow growing. It probably took 10 to 15 years to grow to be noticeable anyway. Nobody wants to do anything ever again if they can possibly avoid it because of my reactions to surgery, to anaesthetics, to titanium. Forget it. Oh, I'm going to live with what it is. All well and good, but I'm going to be forced to do anything again.
So how are you doing kind of now, having been through all this?
Getting used to me still. I know what I can do. I know I'm not as able-bodied as I was. The effect of the balance has had, if you can't see where you're going clearly and your balance is affected, it affects the speed at which you walk and the way you walk. Knock-on effects is back and hip played up. So everything's slowed down. It's getting used to that, having walked 5-6 miles a day to be struggling to walk 50 yards. Different coping with being able to stand, being able to do things around the house and to be able to see what they're doing. It's a different ballgame. You can. It's courage, determination, and lots